Good morning. Today let's study rectum under the following headings: Introduction, Location, External Features, Relations, Interior, Development, Blood Supply, Nerve Supply, Supports and Applied Importance.
Let us study about rectum. The rectum is a distal part of large intestine. It develops from hindgut. Okay, it is actually not a straight structure. As you see, it is not a straight structure. It is having some curvatures. It is having some curvatures. Okay, so we'll take it out and we'll study the introduction of the rectum. See, you can see it is having curvatures. It's not very straight. It is having curvature. This is how it is placed in the pelvis. It has got an anteroposterior curvature. It has got anteroposterior curvature and lateral curvatures. Okay, we'll study about these curvatures when we describe about the external feature of rectum. There are some salient features for the large intestine, like the saculations, the appendices epiploicae, and the tinea coli. All these features are absent in rectum. Okay, all the salient features are absent in rectum. So this is about the introduction to the rectum. Now let's study about the location. If you see the location of this rectum, it is located inside the lesser pelvis. So what is this lesser pelvis? This lesser pelvis is the part below this pelvic brim. Okay, below this pelvic inlet. Sorry, this is a pelvic inlet. So below the pelvic inlet, whatever the part you are having is the lesser pelvis. So it is a organ which is located inside the lesser pelvis. So above the rectum, it is continuous above as the sigmoid colon and below as the anal canal. Okay, below the diaphragm, below the pelvic diaphragm, it extends as the anal canal. Okay, then where it is exactly situated, between which organ? So anteriorly, it is related to the prostate and the urinary bladder. Here we have the prostate and the urinary bladder in case of males, and in case of females, we have the vagina and the uterus. Okay, vagina and the uterus in case of females. Posteriorly, the relation is the same. We can see the last three pieces of the sacral vertebrae. We can see the last three pieces of the sacral vertebrae, and this yellow color structure what you are seeing is the coccygeal vertebrae. Okay, so it is related to the last three pieces of sacral vertebrae and the coccygeal vertebrae. That is the location of the rectum. Next, coming to the dimension of the rectum. If you see the rectum, okay, the dimension, the length of the rectum is approximately 12 centimeter long. The length of the rectum is almost 12 centimeter long. It has a lower part and an upper part. If you see the lower part presents a dilated portion here. This is called the rectal ampullae. This is the place when it is getting filled with the fecal matter, it will create a sensation of defecation. Okay, so the defecation reflex is activated when this rectal ampulla is filled with the feces. Next, we'll study about the curvatures. Okay, already as we described in the introduction, we have anteroposterior curvatures, which is 2 in number, and we have side-to-side curvatures, which is 3 in number. Okay, so first we'll study about the anteroposterior curvature. If you see, this is the position. So anteroposterior curvature, we have, see, it is taking two turns. It is taking two turns. One is like this, and the other one going posteriorly. Okay. So this curvature, which is above, okay, anteroposterior curvature is above, which has a concave anterior part, is called the sacral flexure. Okay, because it is related to the curvature of the sacrum itself. You can see the curvature of the sacrum, and it is taking up the same curvature as that of the sacrum. Okay, so it is called the sacral flexure, and when it reaches near the pelvic diaphragm, it turns backwards. Okay, it turns backwards. This is a pelvic diaphragm. Okay, this part is the pelvic diaphragm, and it turns backwards. And this backward turn here, okay, you can see this. This backward turn here is called the perineal flexure. Okay, it's called the perineal flexure. Okay, this is about the two anteroposterior flexures. So the sacral flexure and the perineal flexure, to anteroposterior flexure. Now we'll see side-to-side flexures. Okay, these are called the lateral flexures or the lateral curvatures. It's 3 in number. On to the right side, we have a single flexure. You can see the convex bulge portion towards the right side. Okay, we have one flexure or the one curvature along the right side, and along the left side we have two curvatures. one at the upper part and one at the lower part. Okay, one at the upper part and one at the lower part. Totally we have three lateral curvatures. Okay, three lateral curvatures. So this is about the curvatures of the rectum. Now let's study about the relations of the rectum. What you are seeing is actually the sagittal section of the pelvis. It's a male pelvis, sagittal section of male pelvis. You can see from front, you can see this is a pubic bone. You will have the pubic symphysis here. Okay, followed by this is the urinary bladder, and this is the prostate gland and the urinary bladder. Then behind this we have the rectum. Okay, this is actually the rectum. Now we'll see the peritoneal relations first. To understand the peritoneal relation, we can divide the rectum into upper 1/3, the middle 1/3 and the lower 1/3. Okay, the upper 1/3, middle 1/3 and the lower 1/3. First we'll see the peritoneal reflections on the upper 1/3. If you see the upper 1/3, the peritoneum is covering the anterior and also the lateral aspect of the rectum. If you see the upper 1/3, this is the upper 1/3 of the rectum. If you see the upper 1/3 of the rectum, the peritoneum is covering the anterior aspect and also the lateral aspect of the rectum. Next, if you come to the middle 1/3, this is the middle 1/3, you can see this is the peritoneal lining. This is covering only the front, not on the sides. See, sides it is getting reflected onto the pelvic wall. Okay, along the pelvic wall it is reflected. So the sides are not covered, only the anterior aspect is covered in the middle 1/3 of the rectum. Next, coming to the lower 1/3. Okay, this area is the lower 1/3 of the rectum. You can notice the lower 1/3 of the rectum is not lined by the peritoneum. You can see the peritoneum is reflected back like this itself along the urinary bladder here. Okay, so along the posterior aspect of the urinary bladder, the peritoneum is reflected. So the anterior aspect of the rectum in the lower 1/3 is not covered by the peritoneum. Okay, it's not covered by peritoneum, and this lower 1/3 is dilated. This rectum, the lower 1/3 of the rectum is dilated to form the rectal ampulla, and hence the lower 1/3 of the rectum is lying below this pouch, the rectovesical pouch. Okay, below the rectovesical pouch. So this is the rectum, this is the vesica, that is the urinary bladder. So this pouch is the rectovesical pouch in case of males. In females, we have uterus here, and hence it is lying below the level of rectouterine pouch. Okay, rectouterine pouch in case of female. The distance between the anus and the floor of the pouch is almost 5.5 centimeter in case of females. Okay, in case of females, it is almost 5.5 centimeter, and this distance is almost 7.5 centimeter in case of males. So this pouch is the most dependent part in case of females. So the rectouterine pouch is most dependent part in case of a female pelvis. Let us study the visceral relations of the rectum. This is a male pelvis. We are going to study the visceral relations of male pelvis. Okay, visceral relations of male rectum. If you see the rectum, it can be divided into upper 2/3 and lower 1/3 for studying the visceral relation. This is the upper 2/3. This upper 2/3 is related to this pouch, the rectovesical pouch. Okay, this is the pouch. So this pouch will be lodging the coils of small intestine and also the sigmoid colon. Okay, and also the sigmoid colon. So that is about the anterior relation of upper 2/3. Now coming to the lower 1/3. So this is the rectum, lower 1/3 of the rectum. It is devoid of this peritoneal fold. So it is directly related to, you can see, related to the base of the urinary bladder. We can see this is the base. It is directly related to the base of the urinary bladder. Then the terminal part of ureter. We can see here. This is the terminal part of ureter. Okay, it is related to the terminal part of ureter. Then it is related to, this is the ductus deferens. Okay, it is related to ductus deferens and also the seminal vesicle. You can see this is the seminal vesicle. Okay, it's also related to seminal vesicle. So it is related to the base of the urinary bladder. It is related to the ureter, terminal part of the ureter, the ductus deferens, and also the seminal vesicle in case of males. Along with this, the lower part, below that area, okay, the terminal part of the lower 1/3 is also related directly to this gland, the prostate. Okay, it is directly related to the prostate. Anteriorly, it is related to the prostate. Now, what we are seeing is actually the female pelvis. Okay, is the female pelvis. If you study the anterior relations of the rectum in case of females, okay, first we have to note all these organs so that it will be easy for us to remember the anterior relations of the rectum in case of females. You can see this is a pubic symphysis, this is a urinary bladder, okay, this is a uterus, this is the vagina, okay, this is the vagina, and this is the posterior fornix of vagina, which will be related to this pouch. This is the rectum, okay, the rectum. So the recto-uterine pouch is the recto-uterine pouch, okay, which is the most dependent part in case of females. Now we'll see the anterior relations of the rectum. So here also for convenience sake, we can divide into upper 2/3 and lower 1/3. Okay, upper 2/3. Now the upper 2/3 of the rectum is missing here. Okay, it has been sectioned. So the upper 2/3 is related directly to the uterus and also the upper part of the vagina. Okay, and also the upper part of vagina. The upper 2/3 is related to the uterus and the upper part of vagina. Okay, and the lower and also the pouch. Okay, and also this pouch, the recto-uterine pouch. And also the contents of the recto-uterine pouch. So what are the contents? The coils of intestine and also the sigmoid colon, okay, which will be related to the upper 2/3 anteriorly. Now, if you come to the lower 1/3 of the rectum, it is related anteriorly to this vagina, okay, it is related anteriorly to vagina. Now let's study the posterior relations of the rectum. It is same for both males and females. You can see the posteriorly it is related to the lower three pieces of, see, this is the first sacral vertebrae, second, third, fourth and fifth. Okay, so it is related to the lower three pieces of the sacral vertebrae and these coccygeal vertebrae. Okay, coccygeal vertebrae. Along with that, we have the anococcygeal ligament here. Okay, it is also related posteriorly to the anococcygeal ligament. If you go a little laterally, we can see these muscles. Okay, so this is nothing but the levator muscle. Okay, this is actually the levator muscle, the piriformis and the coccygeus. Okay, the piriformis and the coccygeus and the levator muscles are related to the sides, are related to the laterally along the posterior aspect. You see some blood vessels. We can see this is actually the median sacral artery. You can see this. So it is related to, posteriorly it is related to the median sacral artery and also the superior rectal and the lower sacral vessels, and also the superior rectal and the lower sacral vessels. These are all the posteriorly related blood vessels. Next, it is related to some of the nerves. We can see these are all nothing but the sympathetic chain. Okay, this is a sympathetic chain. We can see the lower part of the sympathetic chain and also the ganglion impar. Okay, ganglion impar, and also we can see these nerves. Okay, these nerves. These are all the anterior primary rami. Okay, and these are all the anterior primary rami of S3, S4, S5 and coccygeal vertebrae. Okay, and the coccygeal nerves and the coccygeal nerve, anterior primary rami of S3, S4, S5 and the coccygeal nerves, and also the pelvic splanchnic nerves will be related here. Okay, will be related here. Along with that, we can have some, we can also see some lymph nodes and the lymphatics and some fat along the posterior aspect of the rectum. Okay, so these are all the posterior relations which are common for both males and females. Now let's study about the interior of the rectum. If you take the rectum has got longitudinal and horizontal folds. Okay, it has got longitudinal folds and it has got some circular folds Okay, these longitudinal folds are inconsistent and it will get obliterated whenever the rectum is distended. Okay, these longitudinal folds get obliterated whenever there is a distension of rectum. Okay, and these longitudinal folds are more in the lower part of the rectum than the upper part. So the longitudinal folds are more in the lower part, and when it gets distended, it will disappear. Now coming to the circular folds. The circular folds will not disappear when the rectum is distended. Okay, these are all consistent. So these circular folds, otherwise the otherwise the horizontal folds, are otherwise called as the Houston's valves. Okay, Houston's valves or plicae transversales. In contrary to the longitudinal folds, these folds, the circular folds or the Houston's valves, will be more prominent when there is a distension of rectum. Usually the rectum will be empty. Okay, in normal circumstances the rectum will be, most of the time it will be empty. Okay, the sigmoid colon is the place where the fecal matter is stored. Okay, the fecal matter get accumulated in the sigmoid colon. Whenever the fecal matter enters inside the rectum, okay, there will be a desire for defecation. Okay, in a normal circumstance the rectum will be empty. Now let's see about the horizontal folds. Okay, the permanent folds, the horizontal permanent folds. Okay, if you see the horizontal permanent folds, they are three in number. One present on the upper part of the rectum, one in the middle part of the rectum, and one at the lower part of the rectum. Okay, so they are three in numbers, and it is present at three different parts of rectum. Okay, first, to study the upper part, to study the horizontal fold on the upper part, we'll take a section at the upper part. Just imagine this is a section of the rectum at the upper part. So this is the interior. Okay, this is the wall. So this is the wall of the rectum, and this is the luminal part of the rectum. Now, the upper fold will be either projecting from, this is the right side, this is the left side. Okay, either projecting from the right side wall. Okay, either projecting from the right side wall, or it can project from the left side wall. Okay, either it can project from the right side wall, or similarly, otherwise it can project from the left side wall, or sometimes it can partially encircle the entire luminal part, thereby decreasing the luminal area. Okay, thereby decreasing the luminal. That is about the mucosal fold in the upper part. Okay, that is about the circular fold in the upper part. Then coming to the middle part, if you just take a section at the middle part, we can study the middle fold. Okay, so it is the largest and most consistent fold, or the most constant fold in the rectum. So this middle fold is actually present at the level of the upper end of the rectal ampulla. It's present at the level of the upper end of the rectal ampulla and projects from the anterior and from the right walls. Okay, so this is actually the anterior part. Okay, this is actually the anterior part. This is actually the posterior part. Okay, the right side is the left side. So it can project either from the anterior and from the right side. Okay. So this fold is projecting from the right and the anterior part of the rectum. Okay, this is a very prominent fold. Now coming to the lower part. Okay, section of the lower part, you can see the last fold, the lowermost fold, which is inconsistent. Okay, which will be present at a distance of around 2.5 centimeter from the middle fold. It is present below 2.5 centimeter from the middle fold, and this is highly inconsistent. Sometimes it may be absent. Okay, it projects from the left wall. So this is the right wall, left wall, the posterior and anterior wall. So it usually projects from the left wall. Okay, so these are the three mucosal folds. Okay, three mucosal circular folds, which are the horizontal folds. Coming to the development of the rectum develops from two different sources. Rectum develops from two different sources. Okay, it is developing from the hindgut and from the cloaca. Okay, the upper part will be developing from the hindgut and the lower part will be developing from the cloaca. Coming to the blood supply of rectum, first we need to know about this is the lower part of the abdominal aorta. Okay, this is the lower part of abdominal aorta, which is dividing into the common iliac arteries. Okay, common iliac arteries. This common iliac artery will divide into internal and external iliac arteries. Okay, it is dividing into internal and external iliac artery. This internal iliac artery will have two divisions. Okay, an anterior division and a posterior division. An anterior division and posterior division. Here also you can see this. Okay, anterior division and a posterior division. Okay, now let's draw the rectum and study its blood supply. So what you are drawing is actually the rectum. Okay, this is the rectum. This rectum receives its blood supply from three sources. One is from the inferior mesenteric artery, which is actually the branch of aorta. So this is the inferior mesenteric artery. So the terminal branch of the inferior mesenteric artery will supply the rectum. Okay, this is the inferior mesenteric artery, which is the artery of hindgut. Okay, since the rectum is upper part is developed from the hindgut, it is receiving a branch coming from the inferior mesenteric artery, and this branch is called the superior rectal artery. This branch is called superior rectal artery. Okay, this branch is called superior rectal artery, which will be mainly supplying the upper part of the rectum. Okay, mainly supplying the upper part of the rectum, and once it reaches the middle of the rectum, it divides into so many branches. Okay, and runs and pierces the muscular coat of the rectum, and runs along the anal columns. Okay, runs along the anal columns, and it will form looped anastomosis, like that. Okay, it will form looped anastomosis, so it will be supplying up to the anal canal. Okay, the next branch is coming from the anterior division of internal iliac artery. Okay, the anterior division of internal iliac artery, and this will be supplying mainly the lower part of the rectum. Okay, this will be mainly supplying the lower part of the rectum, and this branch is called the middle rectal artery. So superior rectal artery is a branch of inferior mesenteric artery, and the middle rectal artery is a branch of anterior division of internal iliac artery. Okay, anterior division of internal iliac artery. Then the last source is coming from the aorta. Okay, from the aorta, from the posterior aspect of the aorta, there will be a median sacral artery. This is the median sacral artery. Okay, which will be supplying mainly the posterior aspect. This will be mainly supplying the posterior wall of the anorectal junction. It will be mainly supplying the posterior wall of anorectal junction. Okay, so that is about its blood supply. So we have three different sources: superior rectal, middle rectal artery, and median sacral artery. Okay, that is about the blood supply of rectum. Next, coming to its venous drainage. First, let's draw some veins which will be draining the rectum. Okay, so this is the inferior vena cava, the two common iliac veins. Okay, common iliac veins. Okay, then we know there is the portal vein. So this is actually the portal vein, which is formed by the union of superior mesenteric vein and the splenic vein. Okay, so this is the portal vein, formed by union of superior mesenteric vein and splenic vein. Okay, so splenic vein also receives the inferior mesenteric vein. Okay, splenic vein also receives the inferior mesenteric vein. So these are the veins we should remember to know the venous drainage. Now we'll draw the rectum. Okay, this is a rectum. So this rectum will be drained by the superior mesenteric vein. The superior rectal vein. It will be drained by the superior rectal vein, which will be draining into the inferior mesenteric vein. Okay, so this is nothing but the superior rectal vein. The tributaries which will join together to form the superior rectal vein. This is actually superior rectal vein will be draining into inferior mesenteric vein. Superior rectal vein. Okay, that is number one. The next vein is the middle rectal vein. Okay, so this is a middle rectal vein. Okay, which will be mainly draining the ampullary part. Okay, ampulla and the muscular coat which are related to the ampulla. Okay, this is the middle rectal vein. This middle rectal vein will be draining into, see, this is a common iliac vein. This is actually formed by the external union of external and the internal iliac veins. This is the external iliac vein and this is the internal iliac vein. Okay, so this middle rectal vein will drain into the internal iliac vein. Will drain into the internal iliac vein. Okay, the last vein is the median sacral vein. Okay, it's the median sacral vein which will be draining into the left side common iliac vein. Okay, which will be draining into the left common iliac vein. So it has a superior rectal vein which will be draining into the inferior mesenteric vein, the middle rectal vein which will be draining into the internal iliac vein. Okay, into the internal iliac vein, and the median sacral vein. This is a median sacral vein. Median sacral vein which will be draining into the left common iliac vein. Okay, this is about the venous drainage of the rectum. Next, coming to the lymphatic drainage. Okay, next coming to the lymphatic drainage. The lymph from most of the upper part of the rectum, okay, most of the upper part of the rectum will be draining via the superior, see, the lymph will be draining via the superior rectal vessels. Okay, it will be draining via the superior rectal vessels to reach the inferior mesenteric nodes. Okay, the nodes which are related to the inferior mesenteric vessel is the inferior mesenteric nodes. Okay, okay, during its path it will be crossing or it will be passing via the pararectal nodes. Okay, related to the rectum, pararectal nodes and the nodes which are present along the sigmoid colon. Okay, the sigmoid nodes. Okay, pararectal nodes and the sigmoid nodes. Okay, so the lymphatics from the upper part is draining via the pararectal and the sigmoid nodes to reach the inferior mesenteric nodes through the following the blood vessels. Okay, following the superior rectal vessels. Okay, next, the nodes which are the lymphatics from the lower part of the rectum will be draining via the middle rectal vessels. Okay, so it will be following the middle rectal vessels to drain into the internal iliac nodes, into the internal iliac nodes. Okay, it will be draining into the internal iliac nodes. So the chief nodes are the inferior mesenteric nodes which are draining the upper part of the rectum, and the internal iliac nodes which are draining the lower part of the rectum. That is about the lymphatic drainage of rectum. Now coming to the nerve supply. Okay, so the rectum receives both sympathetics and parasympathetic. The sympathetics are coming from L1 and L2, and parasympathetics are coming from S2, S3 and S4. The nerve fibers will reach the rectum via the superior rectal, the inferior mesenteric, or the inferior hypogastric plexus. Okay, inferior hypogastric plexus. Okay, it will reach the organ through the superior rectal, inferior mesenteric, or the inferior hypogastric plexus. The pain fibers of the rectum is carried via both sympathetic and parasympathetics. Okay, the pain fibers are carried via both sympathetic and parasympathetic. Okay, the pain is carried via both sympathetic and parasympathetic. So the distension of the rectum. Okay, the distension of the rectum passes through the parasympathetics. Okay, the distension of the rectum, the sensation of distension of the rectum is passing through the parasympathetics, which will be causing desire to defecate. Okay, the desire to defecate is mainly by the parasympathetic, which will carry the sensation via the parasympathetic. And hence, the parasympathetic will be motor to the musculature of the rectum. So, it should be the motor to the musculature of the rectum and also relaxes the sphincter. Okay, it relaxes the sphincter, thus it causes defecation. That is about the parasympathetics. Now coming to the sympathetics, it is opposite to that of the parasympathetics. So it is inhibitory or relaxes the muscles and contracts the sphincter. Okay. So this is about the nerve supply of the rectum. There are some structures which will form supports for the rectum. Okay, the rectum is supported by few structures in the pelvis. They are mainly the pelvic floor, which is formed by the levator ani. Okay, which is formed by levator ani muscle. Next, the fascia of Walder. Fascia of Walder. Okay. Next is the fascia of Walder. This attaches the lower part of the rectal ampulla. Okay, the dilated part is the rectal ampulla. The lower part of the rectal ampulla to that of the sacrum. Okay, it attaches to sacrum. Lower part of rectal ampulla to the sacrum. That is fascia of Walder. The next we have the lateral ligament. The lateral ligament of rectum. Okay, so it will be extending on either side of the rectum. Is the lateral ligament of rectum formed by the condensation of pelvic fascia. Is formed by the condensation of pelvic fascia. Okay. The next we have rectovesical fascia of denonvillus. Rectovesical fascia of denonvillus. This denonvillus fascia will be extending between the rectum and this prostate and the seminal vesicle. Okay, this is a rectum, this is the prostate, and this is the seminal vesicle. Okay, so this fascia of denonvillus will be extending between the rectum and the prostate and the seminal vesicle. Okay. So this is actually the section of the pelvis, pubic symphysis, urinary bladder, the rectum, and the sacrum. The next support will be the pelvic peritoneum. Okay. Next support will be the pelvic peritoneum and the related vascular pedicles which will also support the rectum. Then at last, the perineal body. At last, the perineal body and the muscles attached to it. And the muscles attached to the perineal body. So these are all the supports of rectum. At last, coming to the applied importance of the rectum. So in every abdominal examination, the examination is not complete without perrectal examination. Okay, perrectal digital examination. Okay, it's a very important examination where we can feel so many important structures through rectum. In case of males, the posterior surface of, you can see in this picture, you can see during the digital examination per rectally, okay, through rectum, when we insert the finger, we can easily palpate the prostate, the seminal vesicles in case of males. Okay, in case of males, we can feel the posterior surface of the prostate the seminal vesicles, and also the vas difference. In case of males. And posteriorly, we can feel the sacrum. In case of females, we can feel the perineal body, the cervix, occasionally the ovaries. Okay. In this position, we can feel the perineal body, the cervix, and occasionally the ovaries. So, the rectal examination plays a vital role in diagnosing the disease related to these organs which are palpable rectally. The next investigation procedure we can do via rectum is the proctoscopy. Okay, proctoscopy. So, proctoscopy is the direct visualization of the interior of the rectum through a proctoscope, by using a proctoscope, where we can identify the internal piles, the growth from the rectum, all these things, and including the ulcers, diverticula, all these things can be identified using proctoscopy through direct visualization into the rectum. Then, prolapse of rectum. The defective support of the rectum will lead to the subluxation or the prolapse of the rectum via the anal canal. Okay, the rectum can prolapse via the anal canal to the exterior, and this condition is called prolapse of the rectum. When there can be something called procedentia, which is otherwise called as complete prolapse of the rectum. In this condition, the whole thickness of the rectal wall will protrude through the anal canal. Then there are carcinomas which can affect the rectum. Okay, the carcinoma of rectum. These are some of the applied importance related to the rectum.